There's a lot to dig deep on in the perimenopausal phase that we have ignored for so long. And like you said, like up to 103 symptoms. It was connecting the dots for many women that they're like, "Oh, I did not know that thing that I was experiencing outside of just an irregular cycle had potentially ties to this hormonal shift." We really used to look at it as just an ovarian issue, period infrequency, then no period. That was really what we were looking at. And there's so much that we're seeing now as far as rates of depression and anxiety, how our bodies carry weight, and the ability to offset that change in insulin and glucose. And so I really want to inspire women, especially if they're listening, is to pay attention to their body and really ask themselves, could this be something that is attributed to perimenopause? And even if it isn't, that doesn't mean that it shouldn't be paid attention to, but we have to learn to listen to our inner voice a little bit more about what we're experiencing, because in the end, if we ignore it, that's when disease does show up. And I would prefer for us to be on the other side of disease in prevention rather than treatment of disease when it gets there.
This is a part two, a continuation of our discussion. And what I started to ask Dr. Shepard today was about, can you predict when you'll get into menopause, when you're in perimenopause? Is there a way to test? And there's some reasons why I asked that, but that's the first question. And then let's move on after that.
Yeah, you want to go right for the jugular and being like, what can we do to predict perimenopause and menopause? Now, we don't have the magic pill or test that says this is when you're going to go into it by dates, say. But what we have become better at is using technology to help understand the process of perimenopause, which can somewhat give you a much better idea as far as accuracy of where you are in the perimenopausal phase. And the reason I say that is because if we look at perimenopause, which can last anywhere from 10 to 11, even sometimes 12 years, depending on when you start, there are phases of perimenopause: early, mid, and then late. And early really is that time frame in where your hormones start to fluctuate, but very infrequently, or maybe the changes in the ratio between estrogen and progesterone are very small, right? So you may not have as much as the symptoms. And then you go into your kind of mid era where we start seeing a little bit more frequency in the symptoms, and that fluctuation between the hormones becomes a little bit more severe. And then late is pretty much when you're at that stage where the decline of estrogen and progesterone are really on their way down to a menopausal level, which means now we're getting to the point of menopause where there is not enough estrogen to elicit a cycle. And so that's why it's important to understand perimenopause as a transition in a phase, because it's like this slow evolving transition where the decline of estrogen and progesterone takes time. Think of that over the course of 10 years, you have this slow incremental decline. And so that's why it's kind of coursed out in the way that I just described. But now we have technology that's able to help women understand the symptoms they're going through, where their hormones at, what that fluctuation is, and guiding them to a clear idea of when menopause is going to hit.
Okay, this is useful still. And I think as much as we'd want to know, when is this going to end?
I
um,
know.
Understanding that perhaps, I think, particularly for a perimenopausal woman who's maybe in the early
Mhm.
phase or mid phase, who isn't really sure what's going on and doesn't know very much about perimenopause, maybe suspects it, wants to
Yeah.
know, is this menopause or fluctuating hormones, or is this completely something else, which totally could be something else. So I think some of these devices are actually could be really useful and say, oh, okay, yeah, I'm see consistently progesterone, let's say, is declining. Maybe start on a little progesterone cream as a place to get started to see if that helps or not, if it is a hormonal thing. And I think these devices or this technology is coming out, and there's a bunch of them on the market too. And so I don't have any feedback yet on what people like the best or what is the best. I'm
Yeah.
testing one out now, and I've only used it for about a week. And even though I'm post menopause, I'm on
Mhm.
hormone therapy and I am seeing things, and I'm trying to understand them better to see why wouldn't we want to use this, and
Yeah.
for trying to titrate or try to figure out our hormone dosage
Yeah, I
because
think there's a lot of utility in exactly what you just said. Even if you're postmenopausal, even most of these technology markets are geared to the perimenopausal phase. But here's another reason why tracking data in the way that we have seen these technology kind of focus on is to actually help the provider. Many times when a patient comes to see me, I'm like, okay, so tell me what's going on. And they may say, oh, I'm having hot flashes. For a physician, we want to know when, how frequent, what are they like, what's the severity? And many times women will then just like stare at me because they're like, oh, I didn't really track all of that, because the tracking of that helps us understand maybe how far into perimenopause you are, how severe they are, what we can do to help on the other side with hormone replacement therapy or even other medications or modalities. And so it becomes this tool where a patient can come in and say, here's all the information I inputted into this data set or this device, and we can look at it and use it for its really good clinical value in order to give us more ideas on how to actually meet the woman where they are with what managements we have to offer.
What are you seeing in terms, if you know, I'm not sure, in terms of differences of these
Hmm.
devices? I only understand one, and you just pretty much pee in a cup and then you
Yeah.
dip the stick into the cup, kind of like a touch test or that dry urine test of comprehensive
Hmm.
hormones. But you don't dry it, but you just stick it in this little device connected to your
Yeah.
phone and it has a reading. And I don't know yet how accurate these are, but are they more or less all kind of work the same or are there differences?
There's differences. So, for example, you have those that use urine, and then you insert that into something that is technically going to look at your LH hormone through the urine, and then be able to help you with hormone fluctuation. Now, you have those who use temperature, and they will take temperature through your Aura ring or the device that they have, and then it inputs it into the app, which also helps with helping you understand your hormones. And those are the ones usually that I've seen on the market that are looking at either temperature or urine. And what's different to what we see in like fertility tracking or period tracking is that in contrast to what we see as a monthly menstrual cycle, the perimenopausal transition does not follow this regular cadence, which is what we see in menstrual cycles. And that gradual transition to menopause, because it lasts so long, this is where the supply of your follicles and your eggs dwindle and the production of estrogen becomes so inconsistent that it gives us the symptoms that we have. So these tests are actually using some form and combination of luteinizing hormone, which is your LH, and then your FSH, and progesterone and estrogen in order to help guide a woman in what those fluctuations are. And the other part why this is important is because even though perimenopausal and menopausal women are going through symptoms, hot flashes, night sweats, irritability because of the hormones, we also need to look at how that's impacting other things such as sleep, mood, our bone health, our weight fluctuations, our heart health, and also skin. So there's a lot that can be looked at for what these devices offer, in addition to can I predict when I'm going to go into menopause?
So what I'm not really, I would love to know if there's a device that could take a blood, like a blood spot, kind of like a glucose, not a glucose, yeah, glucose monitor, not the
Right.
even more ideal if you could have continuous glucose monitor that looks at your
Mhm.
hormones. Maybe one day that will happen. But I don't know if there's one that exists with the blood because when I'm
I'm
looking,
not sure if there is one. I feel as I'm saying it, there's one that's out there, and maybe they're just in the early startup phase. But yeah, serum typically is what we use. But the problem is, we would have to be going to send someone to a lab every day to draw a vial of blood. And what we have seen in the diabetic kind of test that we say can turn around a result very quickly is that we would love to be able to see hormones in that fashion, or even your FSH, LH versus estrogen, progesterone, being able to do at-home kit where you're using that small amount of blood to be able to detect that. I think that would be fascinating. And I would love if I were wrong that there is something out there that does that, because I think that would, again, the market where we are right now, I'm fascinated by it. I'm actually very glad that we have the options that we just talked about, but adding serum to that would make it even more inspiring for women's health.
yeah, the research that is out there on hormones and
Mhm.
hormone therapy and are done mostly on blood. So that's where
Yeah.
we get a lot
Yeah.
of our information from and then can apply it
Hmm.
to the patient. But I love the idea that you can test every single day because I think this is the problem doctors have when who don't like testing at all. They said, well, it's just a snapshot in time, and what are we going to do with this?
Yeah.
And this is where I would say, well, then you have to do various things, various tests, and get look at trends and try to track. But
Yes,
that gets expensive, and not everybody can do that
it
either.
is. And that's where technology lies, is the startup world in technology requires so much innovation and also capital in order to make these devices. So I was speaking yesterday on a stage about technology and innovation in women's health. And one of the biggest obstacles to health in general is access and equity, right? So this allows people, whether they're able to get to a lab or a doctor's office, to have access to care that helps define where they are in a process or help a physician being able to manage them, but also equity, because this is something that everyone could use at some point, when technology has come to a point where everyone can have it. But we're so early in that should be the outcome that the company should be looking for. But this again evens the field when we think of who is going to be able to manage their women's health transition of perimenopause for everyone who enters that phase. That's really the goal. That should be the goal.
What do you say to a woman who comes in and whether you can define this for me if she's perimenopause or
Mhm.
menopause and she says, I want to test my hormones.
Yeah.
How do you apply to that?
Yeah, I will even being very transparent. I used to be, because that's how I was taught, is in perimenopause, there's no reason to test labs, which has some truth behind it because you really need like a daily test, or even if it's weekly, to see what that trend is in the fluctuation of hormones. So before it used to be like, you're in perimenopause, you don't need labs, which has some truth to it. What I have expanded to is seeing that it is okay to get a baseline because in the fluctuation of hormones, you can still potentially see that maybe there's a severe deficit of one of them, which you can offset. But because I look at perimenopause and menopause differently into not just a hormonal phase, but a whole body experience, I find that's when I'm actually able to help women be preventative with their heart health, be preventative with pre-diabetes or diabetes, their weight management issues. And hormones has a lot to play with that as well, and also thyroid. So I do believe that we should not have it all or nothing, being like you can't get your labs versus we're going to run labs every 3 months to see what that looks like, is still allowing women to have the autonomy to ask for it. Granted, I may not be able to give you exactly where you are in a phase and why you're there from a blood draw, but it still allows a baseline to help someone in their overall health, because we have to start looking at as an overall body and health experience rather than just typecast to do you have your periods or not. And that's what we've done for so long, which is the reason why we wouldn't draw labs, because we would ask them, well, do you still have your period? And if they said yes, we were like, well, you're not menopausal, so you don't need labs. That really was fundamentally where we made that decision. And now I've kind of expanded out of that in my practice and how I approach perimenopause, because I look at it as an entire body experience.
Yeah, there's so many moving parts and a lot of things that maybe
Mhm.
women don't know is associated with
Yeah.
menopause or the loss of their hormones. Andrea Donsky has done some research, published
Mhm.
research on
Mhm.
103 symptoms of menopause. And most of us are thinking about
Yeah.
two or three, like hot flashes and maybe period loss, maybe mood or libido, but so many other symptoms that could be
Yeah.
menopause related. Now we don't know, but if
Hmm.
you're not, if the patient isn't aware, even aware of that, and you
Yeah.
ask how you feeling and she doesn't have hot flashes and she periods are
Hmm.
maybe not completely regular but more or less regular, then
Hmm.
how is she she may have so many other symptoms and she's just not aware of it, and that's where I think as a doctor you probably dig deeper and ask more
Oh,
questions.
there's a lot to dig deep on in the perimenopausal phase that we have ignored for so long. And like you said, like up to 103 symptoms, it was connecting the dots for many women that they're like, "Oh, I did not know that thing that I was experiencing outside of just an irregular cycle had potentially ties to this hormonal shift." We really used to look at it as just an ovarian issue, period infrequency, and then no period. That was really what we were looking at. And there's so much that we're seeing now as far as rates of depression and anxiety, how our bodies carry weight, and the ability to offset that change in insulin and glucose. And so I really want to inspire women, especially if they're listening, is to pay attention to their body and really ask themselves, could this be something that is attributed to perimenopause? And even if it isn't, that doesn't mean that it shouldn't be paid attention to, but we have to learn to listen to our inner voice a little bit more about what we're experiencing, because in the end, if we ignore it, that's when disease does show up. And I would prefer for us to be on the other side of disease and prevention rather than treatment of disease when it gets there.
Yeah, there are not enough doctors that think like that, unfortunately. And so maybe don't even have the time if you got 15
It
minutes to
is,
deal with a
there
patient.
is a lot of time that is devoted to treatment of a disease, right? Diagnosis and management. And I think that's where the career or the discipline of medicine really was, is when someone has a problem, we were there to fix it. Does that mean that we are contributing to the health of a person? Not necessarily, but that doesn't necessarily mean we don't have to stay there. We can change that narrative. And I think we are starting to see that with the integration of wellness, prevention, functional medicine, and then your allopathic true diagnosis and disease management medicine. And we need all of them. And I don't think they should be pitted against each other. I think that there should be a true integration of what that can mean for every patient who walks through the door, but also every physician who has a patient sitting in front of them to look at it in that way versus I'm just going to wait until the disease showcases itself.
Yeah, you're right. So if somebody walks into your office again, like here, I like to this scenario, and she wants to get on hormone therapy. Let's say she has some of the symptoms. She seems could be a good
Mhm.
candidate. I'm not really sure. Is there questions? What are the questions that you would ask that patient before deciding to give them some hormone therapy?
I like them to tell me their story because every woman who walks in has a different story, a different attribute to it, severity. And I believe women are very beautifully complex in how we think, but how our bodies showcase this transition. And there's not one template. So I always start my visits with, I'm so glad you're here. I know that this can be either difficult for you or it can be maybe overwhelming. But the best job that I can do for you is if you tell me your story so I can meet you where you are. And so then and many times I'll be like, well, where do I start? And I'll say, well, when do you think you noticed that something was changing? And what were those changes for you? And that's where we start. And then we dive in. And then I'll explain to them what is that correlation to potentially a perimenopausal transition, what the hormones mean. And that takes a lot off of their shoulders of maybe blame, this is my fault, or I did something to elicit this. And then we go into what do you want to do with what I have to offer?
Do you ever ask for a history of breast cancer history, or if they have dense
Yeah.
breasts or
Mhm.
childbirth or something?
That, yeah, their whole family history. I asked for history of cancers, including, in addition to breast, is like ovarian and uterine, any reproductive cancers. Colon cancer is another one that I dig deep into as well. And then heart disease, like what does their heart disease profile look like? Have they had a significant family history? Are they on medications already for heart disease? Because heart disease is a really big umbrella over hypertension, arrhythmias, atherosclerosis, have they had lipid issues? Are they on cholesterol meds? That all contributes to heart health as well. And then I also go into emotional slash mental health of have they had issues with depression and or anxiety? And are those exacerbated during this time frame that they've noticed as well? And even things like sleep, what it has sleep changed, sexual health. So there's so many parameters that need to be explored through this. And again, a lot of women don't connect the dots. So they don't know necessarily to bring up something that actually may be aligned with the perimenopausal transition or not. So it's always worth bringing up so we can take the pieces of the puzzle, put them all together and say, do these all fit this puzzle? Are some pieces maybe not for this at all?
There's so many things. Are there any questions that the patient should be asking the doctor?
Ooh, I like that. I think that there's so many questions that can be asked. And the reason why I say this is not all physicians know about the true whole body transition of perimenopause. And I'm not here to shame or blame them. We are not that far in where we are seeing menopausal medicine, midlife medicine. So sometimes the questions that may be asked from a patient to a physician is saying, here's my experience, or here's what I've heard, whether they're listening to this podcast or whether they've kind of forayed into social media and heard all of the different things that come with it. Here are the things that I'm experiencing and the things that I've heard. Does this align with you or something that you're comfortable with dealing with? And not all physicians are as honest because that can be a little bit, oh, maybe I don't know everything. We're very much like we know everything. That, that just comes with the territory, and that's okay. But if some are like, you know what, I'm not, that's a real honest answer. And then that can allow you to kind of figure out what you can figure out then, and then maybe try to find someone else who can address the other issues as well. I think this has to be such a collaborative effort. I think that egos should be dropped. That's hard to do, by the way. And take out the shame from a woman's perspective of being like, I'm not going to bring that thing up. Yeah. Whatever that is, that thing could be anything.
Yeah, there's questions that I think definitely, and that'll give you a clue if this is your doctor or not. Maybe that doctor is going to be great for
Yeah.
pap smears or something else,
Mhm.
but maybe it's
Mhm.
not your menopause doctor. And by asking these
Yeah.
questions and bringing it
Yeah.
open, you get a clue and you can go somewhere else. But
Hmm.
what is it like to get? I don't know if you get now that we have social media and women are learning a lot through podcasts or Instagram or books that they're
Hmm.
reading, and they come into their doctor full of knowledge. And I don't know. I'm still guessing the percentage is still quite low globally that in terms
Mhm.
of health literacy in menopause literacy, but you probably attract the literate woman. Do you see women, most of them coming to you specifically fully armed with information? They still may be confused, but they have more knowledge than perhaps someone who's just getting started.
It's a really good question because there's so much unknown by women about this space. So I'm never shocked by some of the questions. And even for the patient who may be very literate in this discussion or topic, when they come in and I give a lot of the data they're like, oh my goodness, I never knew that. I still find myself a lot of times giving quote unquote 101 of perimenopause to everyone who walks in because it's so broad now that we're seeing the data and how it's a whole body experience. Most women do not have as much info as we think they may, even if they come in sounding quite well versed in it. There's so much there. And that really makes me actually proud to be in this field because we have so much more to do. We have so much more women to meet that the work is not even close to being done. Yeah.
All right, I have to let you go, and I could talk to you for another three
We
hours.
could talk forever. I think we do this, and we really should start recording just our conversations because we really do cover a lot when we talk. And then we'll be like, oh, yes, let's press the record button.
Well, hopefully you'll come back. And before I let
Yeah.
you go, I would love to know a little bit more about your collective, the community Modern Menno. What is that?
Yeah. So Modern Menno is the community that I have built from exactly what we were just talking about. What's new in technology? Why would I get a lab draw? What pertains to me in my perimenopausal phase? Kind of like my patients are my seeds into what created this community because there's still so many questions out there. So it's Modern Menno. I will share the link with you and your followers and listeners. And the goal is to come in and create community because that's the other thing that's lacking in this space is community. And so it allows people to have community, but also led by people that I feel give really good information in all aspects of midlife, which could be exercise, could be why should I take creatine, exercise physiology, nutrition, movement, brain health, therapists who have seen in midlife women how this can destroy relationships and marriages. There is so much behind this that I just wanted the ability to have women in a smaller space than maybe when I'm speaking on stage and doing the things that reach thousands of women is to saying, you know what, I have a question. I know where I could go to ask this question and have community surrounded to help foster that, but also to have experts and access to me as well to get that information. So it's Modern Menno. On Instagram, it's MODERN Modern Menno. And then I will share the link with you so you can come and join Modern Menno, the community, because there's still so much to learn.
Oh, sign me up. Yes.
Yeah.
Give it to me. I want to jump in. I will share the link with everyone else. And also, we didn't talk about your book, Generation M, because we talked about that in the
Yeah.
first episode, but it's a foundational Menno Bible everyone should be having on their bookshelf. Before I let you go, is there anything else that you'd like to share or things that
Yeah.
we should?
Generation M is to me the love letter to women who are just starting this journey. And even if you're far into the journey, it's something that you can go back to. And I wanted it to be relatable, something that could be on your coffee table. You can put dog ears in it. When women come over, your friends or family, you guys can sit on the couch and being like, did you read this? This is something that is light, but still giving me so much information, but also hope in understanding that this is something that happens to us biologically, but in that we have choice in how to navigate that journey. That's the most important part of all of this.